Thank you.
Good evening and welcome to Arizona Horizon. I'm Catherine Anaya in for Ted Simons. Governor Doug Ducey on Monday declared an emergency to deal with Arizona's opioid epidemic. That came after a report showing overdose deaths from opioids up 74% in 4 years. As part of the emergency declaration, the Arizona Department of Health Services opened a health emergency operations center. Tyler Fingert was at the center as it launched.
This is going to save lives.
New urgency in the fight against opioid overdoses.
We're hoping to make an impact on it with some quick, decisive action.
At the Health Emergency Operations Center in Phoenix, this is what they've been prepping for.
Every situation has a focus. This one being opioid is new for us.
The Operations Center is a statewide multi-agency coordination center with a goal of protecting the public from health threats.
The suspected opioid overdoses.
The state health department has been looking at the opioid problem for a while, but without reliable data, it's been difficult to track.
We don't have great data on opioid deaths. Our opioid death data can lag a year behind. And so we noticed in October we were still updating deaths that occurred in January.
The health department is taking a look around the country, looking to other states for the best way to handle the problem, with a goal of making Arizona just as good or better.
I think every state is in a different spot, so I don't know that we have catching up to do. I think the entire nation has been impacted, and some states have best practices. In Arizona, we have some best practices, so that's why it's so important to do that 50-state crosswalk.
This is the first statewide health emergency in at least 10 years. Here with more on what the state will do to combat this epidemic is Dr. Kara Christ, director of the Arizona Department of Health Services, and Scott Summers, a former Mesa City councilman who was a contributor and signatory to the Johns Hopkins University School of Public Health document, The Prescription Opioid Epidemic. Thank you both so much for joining me to talk about this very, very critical issue. We're talking about more than 2 people a day dying from prescription opioid or heroin overdoses. What exactly, if you can break it down for us, is this state of emergency intended to do?
So this state of emergency is intended to focus the public health system on this epidemic, just like we would an Ebola or flu outbreak. So getting public health data that is real time, that will be able to target communities and give us information about what interventions to implement in those communities to save lives is one of the major points of this declaration.
Well, and it's long overdue. We're looking at a 74% surge just since 2012. Could the problem actually be even worse, and maybe it's just underreported at this point?
It could. Part of the problem we're having in tracking a lot of our medical issues, but particularly this one, is that our data sets don't often talk to one another. So there's some fairly decent data coming out of emergency departments, for example, that talk about the scope of this problem. But where it's not connecting necessarily is with emergency medical services. Community paramedics are providing healthcare services in the field and are able to counteract these overdoses, and those may not make it back to the state. So this could be a very underreported problem.
Well, and you know this firsthand because you're a paramedic. What are you seeing out there on the streets?
We're seeing a significant rise in the number of overdoses and deaths, not just in Phoenix, but nationally as well. And what's driving that are prescription medications for pain. Oftentimes people will get these prescriptions, they won't fill them out, they won't complete them, and then they sit in the closet, and oftentimes they're used for non-medical reasons, either shared with friends or they're taken by family members and abused.
And the problem here also is that people obviously aren't taking these intending to be addicted. They become addicted, and it becomes a gateway to what we're seeing with these heroin overdoses, right?
Right, absolutely. So most people believe that this is prescribed by a doctor. It's safe, and we underestimated the addictive potential of these medications and how deadly they can be. So what we really need people to understand is that these are medications, they are dangerous, they are addictive, and they can have deadly consequences if taken in combination with other medications such as benzodiazepines, Valium, Ativan, or if you take too much. And so people don't take these medications. They're looking for pain relief, and they don't understand that it can be dangerous.
When you talk about the people this is affecting, who specifically are we talking about? Specific age group?
This is impacting our entire spectrum, but surprisingly, our highest number of deaths is in our 35 to 65-year-old age group. And so a lot of people think that drug overdose is seen in the younger ages,
right.
And we are seeing this in our middle-aged population. And there's probably a variety of reasons why that is. We just don't have great data right now to be able to help target interventions.
Well, one of the things that this declaration will do is help to better manage the numbers, the cases that are being reported. Will it also help people get better access to treatment?
Well, that's certainly one of the hopes. And the community solutions is really around identifying the problem, helping people recognize when they have a problem, and then connecting them to the help that they need. So the fire department is a great place to start because paramedics who see this every day, and here in Phoenix we're fortunate to have a lot of folks who work on what are they're counselors that work with the fire department. So first responders can contact those folks and they will help you get in touch with drug addiction programs to help with this problem.
Well, you've been at the forefront. In your personal opinion, what do you think is contributing to this epidemic?
I think it's a combination of factors. I think part of the problem is that people who are prescribed their medications don't necessarily maintain control of them, and when they're done with them, they're not disposing of them. Almost every city right now has a disposal program, either through the fire department or certainly through the police department. You're starting to see these every day in some of the drug stores where you can take your prescription medications back. So I think it's availability. But there's also a problem of overprescribing. We've seen things like fentanyl is extraordinarily dangerous to first responders. It is readily absorbed. Just recently we've seen some police officers in Ohio that were accidentally exposed to the powder, and they had overdose reactions. The prescriptions for those went up 222% between 2000 and 2007.
That's incredible.
That's an incredible number, and it's a very potent drug. But it's a necessary drug. There are people who have surgeries and chronic pain that have to be managed. But when the drug gets out on the street, it becomes a hazard to children, but a hazard to first responders as well.
Well, so will this declaration also make it so that there is a limit to how much of this can be prescribed by doctors?
So one of the directives that Governor Ducey gave to the department is develop recommendations for him to take forward. We're not at that point just yet, but we will be working with stakeholders and partners to determine what are the best practices and what are the evidence-based practices.
And I want to present this question to you as well. What do you think is contributing to this issue? Because I know we talked about it's a number of things, but any other things besides what Scott mentioned?
You know, I think that as one of the things that we need to be careful as a medical community is each stage needs to be dealt with in a different manner. So you want to prevent those that have never been on opioids from becoming addicted and introduced to them. Those that are on chronic opioids for chronic pain and have been on for a while, you don't want to cut off their supply. They need that medication. They are used to the medication. So you want to work with them to understand how to use it safely and potentially how to wean them off. When you cut off the supply, that's when you drive people to the illicit forms, such as heroin, because we know 80% of heroin users started as prescription drugs, and there's no regulation of heroin or illicit drugs. So you want to keep them safely monitored by the medical community.
What can you tell me about the overdose drug Narcan, and how will this declaration help get that drug to the people, the communities with those high numbers of deaths and overdoses?
So Narcan is the overdose reversal drug. So you can give it to somebody who's overdosed, and it can revive them long enough to get them to medical care at an emergency room. And that's really what you're trying to do to save lives. The declaration does direct the department to get Narcan or naloxone into the community. So we are actually going to be purchasing naloxone for law enforcement enforcement, for first responders, for public health, and the community. And then educating the community. If you have a loved one, you can go to a pharmacy, you can get it without a prescription, you can get it from your doctor, and know how to administer, because you could save your family member or loved one's life.
Is that going to make a difference, Scott?
It can make a tremendous difference, and particularly for emergent incidents of overdose. And I have some Narcan right here. It's very safe. So the medication works on your nerves, and it holds on to receptor sites on the nerves. And what this does basically is it just kicks it off. And if you have too much of an opioid, it stops you from breathing. So by using this drug, you start people breathing again, and that's what saves their life. The good thing about Narcan is it's extraordinarily safe. So you could take this right now and it will have absolutely no effect on you. So, and as you see how I have this one set up here, we can put this in someone's nose and it's readily absorbed, and it has the proper effect without having to use a needle. So this is the type of thing we're hoping the governor will take a look at, and possibly not only to make it available readily, but also encourage physicians who are prescribing opioids for pain relief, perhaps to teach family members how to use this medication in case of an accidental overdose.
Do you think that'll make a big difference, Doctor?
I think that will make a big difference, and that is one of the recommendations that we are going to be making to healthcare providers. We're also working on hospital discharge guidelines to ensure that those that go into a hospital for an overdose, you know, we hook them up with peer counselors, we get them into substance abuse treatment if they're ready, but they walk out of the hospital with a filled prescription of Narcan and know how to use it, because that's what's going to save lives.
Well, and would the move be to get pharmacies to be able to give this out without a prescription? I mean, is that the idea?
Yes, so legislation was passed that does allow pharmacists to dispense without a prescription. So you can go to a pharmacy and say, I'd like to get Narcan, and they would be able to get it if they could pay for it.
Well, we're certainly going to stay on top of this issue because, as you mentioned, it is a crisis. It really is. So thank you so much for bringing it to everybody's attention, and, of course, the governor taking the lead on this. We appreciate you being here. Thank you.